Kinematics is a branch of mechanics which deals with pure motion with no reference to force or mass. An injury occurs when there is a reaction between an object and a victim, both of whom could either be in rest or motion. Now the object could be either a bullet, radiation, or it could even be a piece of glass or the car. Newton's first law states about inertia, saying that a particle or an object could be either in rest or motion in a straight line unless acted upon by an external force. The second law deals with force, saying that it's mass into acceleration, and therefore the impulse is the change of momentum. The third law states that for every action there is an equal and opposite reaction. Now energy, just like momentum, has to be conserved, and nobody can create momentum. So when two objects hit each other, there is going to be a change of velocity of the rapidly moving object, and all this sudden change in velocity and reduces it to zero velocity. Thus, this is the work which is done, the change of momentum, and this is the one which is used to deform the tissues. And all this work during a collision or even during the stab injury or a gunshot injury is transferred to the victim. Of all the collisions, the front end collision, either end to end or offset, is the worst. All the momentum is used to deform the victims. Comparatively, a T-bone collision is better because the momentum is used to move the vehicles together. A rear end is the best because the amount of momentum that is there will hardly deform the victims. If you can see the way the tent pole tents the tent, the similar thing happens when a bullet goes through the body tissues. As it goes through the skin and the fascia, it will tent it, and then there is a reverse tenting which occurs as it goes through the muscle. This three-dimensional tenting forward, which creates the cavity, and thus you can see how a cavitation occurs during a bullet path. The bullet can either yaw or tumble. It can even fragment and mushroom. Thereby, this is how a bullet causes damage. Hopkinson's law states that the distance traveled to the power of 3 is equal to the weight of a certain explosive, which means to say, if you calculate that if there is a 1,000 kilo explosive, it travels to a distance of almost about 10 kilometers. Whereas had it been a 2 kilo explosive, it would have traveled 1.42 meters. And the next thing that you will need to know is that when there is an explosion, there is going to be a peak over pressure which happens in a moment of seconds, and then there is going to be a negative wave which sucks everything back into the epicenter, which occurs again over a period of seconds. So one would feel a positive and a negative wave during a blast. The particles of a blast wave have density, velocity, and temperature which can cause damage. Even worse than that is ionizing radiation, because the positive wave lasts for seconds and the radioactive material undergoes decay, which has a lasting effect. The Young's modulus or the bulk modulus is the resistance to compression or deformation which is offered by any structure. For example, an air-containing structure like the bowel can be easily compressed, whereas if the bowel is full of stool, it is difficult to compress it. Now, stress is defined as the force applied per unit area, whereas strain is defined as the stress applied per unit length. For example, if I carry a heavy weight on my back and I'm trying to do a squat, there is a stress on my shoulders and my back, and there is a strain on the muscle fibers. All body structures, body tissues, and even metals have 3 phases to undergo failure. First, when they are deformed, they offer some resistance, so that's called the elastic phase, and they spring back to shape. The next is the plastic phase, where they undergo a permanent change in shape, and in the last stage is the failure stage or fracture stage, where they undergo complete failure. That means to say, could be a laceration, could be a fracture, etc. Now, when we talk about the strain applied on tissues, it could be a linear strain, which can cause a fracture. It could be a vertical shear strain, which could cause fracture of a pelvis. It could cause a compressive force, for example, force applied on the liver or the spleen. And if too much compressive force is applied, it could be an overburst injury, thus resulting in laceration. Now, looking at the patterns of injuries, the mortality as far as the road traffic accident is concerned, in the frontal collision, 60% of mortality, T-bone collisions, 30% mortality, in the rollover injuries, 8 to 15% mortality, and finally the rear end collisions, 3 to 5% mortality, for the reasons that we have already seen. When you talk about the morbidity, the victims of the rollover injury get ejected and there is a sudden deceleration. Now this leads to a lot of damage, and in the end they will have 5-fold increase in the injury severity score and death from the injuries. There is a 4-fold requirement of ICU and 3 times more likely to have brain injury than other patients. When we also discuss about the injury patterns, in a frontal collision, if the patient is usually obese, there is a sliding down of the patient which leads to a posterior dislocation of the hip. It can also lead to popliteal artery injury. When the steering wheel strikes the victim, or rather the victim strikes the steering wheel, the chest and abdomen get injured, therefore leading to rib fractures, pneumothorax and hemothorax from various popping of the lung and the lung vessels, even the intercostal arteries. There is even a blunt cardiac injury and cardiac contusion, injury to the liver and the spleen. Now one should remember that this is a horizontal kind of a traction applied on the heart. Therefore the most mobile structure there is the heart, and the least mobile is the ligamentum arteriosum. And this is the reason why there is going to be a tear or a transection of the descending aorta. One can also expect that the trachea and carina are relatively fixed, and the mid-stem bronchus around 2 centimeters from the carina is mobile, so that's the place to expect injuries. In the likely event that the patient slides up instead of sliding down, the same injury is seen in the thorax and chest, but in addition there is a whiplash injury to the neck, and the head will hit the windshield, causing a sunburst pattern on the windshield. If supposing there is going to be a lateral injury, let's say a T-bone collision, there is hemothorax and pneumothorax because of lung injuries. In addition to that, liver, spleen and kidney injuries on the side, and also the femoral head gets driven into the acetabulum, causing a fracture of the pelvis. And finally, the rear end injuries, most of the time it's only a whiplash injury. When it comes to a pedestrian vehicular accident, the pattern that is usually seen, as shown here, is first there is injury to the leg, fracture to the tibia fibula, there is a tibial plate fracture, fracture or dislocation of the knee, then the pelvis will strike to the hood or the ground in front of the pedestrian, therefore causing a pelvic fracture, also leading to liver, spleen, kidney injuries, hemothorax and pneumothorax by mechanisms already explained. When there is a fall from height, usually the fall from height could be from 5 to 70 meters, maybe because from 5 to 70 feet, maybe because those who fall from less than 5 feet, it's almost insignificant, and when one falls from more than 70 feet, he is lucky to be alive. 70% of the patients or 75% of the patients will have fracture. 25% of them would have injuries or fractures to the spine. 4% of them will have neurological deficits. Around 6% of them will need to be taken to the operation room for injuries to the solid organ, and only 1% of them will have bladder and bowel injuries. The take-home message is that greater the momentum during the accident, the greater the damage done to the victim. Victims of ejection due to a rollover injury have a worse prognosis, and the mechanism of injury itself will make you look for a classical pattern of injuries. Also, it helps you to predict the blood products required, the ICU care if needed, and the requirement of operative intervention.